This program contains content that may not be suitable for viewers under the age of 18. Viewer discretion is advised.
Ruzungu kadera zuku tujikole sawa namba ruzungu.
Ruzungu tujikole namu za kujele kutoka ntoko ndimbuzi ndi hapo ana bora babaddi abachala wale somo yomba nyembuto katonda ya chembuto genda weji waminge yabawereza buno bukeke obutini
singa babu mutwale bamusonseka mukamwa bwonna nawufulumiza mu nnyindo
kibwa ina guno omugogwa Musa white step bibia mu detergent
waliwo wanangabi ebola yakasajja kasendi kalimba bannange sendi bannange. Good morning, good evening, good afternoon from wherever you're watching us from. Welcome to Speak to the Doctor here at TMR Golden Living Specialized Hospital. And today we are with a gynecologist, a gyna. Gyna. Yeah. Chiriche na wachingobia. We are with Dr. ELADU. He's a gyna here at TMR.
Yes.
How are you, Sevo?
Fine, thank you.
How is life?
Life is okay. You know, I keep reading the comments and people are saying, "Ngamufanaganda."
What is that supposed to mean?
I don't know.
Like we look alike.
But we resemble. Every time.
They don't know what they are talking about. Now, today, we want to talk about infections.
Yes.
These days, infections are in children, they are in women, and they are now also in men. It's so common to again what are infections? They are UTIs, urinary tract infections. What are UTIs?
So, let me first greet the viewers. Welcome to this talk to the doctor with the Kasuku. You see, at the end of our discussions, I hope you will become a mini doctor, Kasuku. People will start consulting you.
There is a friend of mine. He one time he was sitting at his hospital, at his clinic outside there. So someone came and a doctor, then he told him, "Oh, you know, funayo panadol." 2 times 1. So the next time the person gets like, but he owns the clinic, but he has his knowledge.
Is it the fingertip?
Yes, he does. So maybe in like a month or 2,
it will be good. I can already see
you.
So infections. When we say infections, you see, that word is very, very broad because it means that is something that has entered your body that should not be there.
From outside?
From outside.
Also, infections are from outside?
From outside.
Okay.
Your blood is supposed to be sterile, meaning that you are not supposed to have any disease-causing organism inside your blood system. Okay? So when any bacteria enters into your blood system, when any viral disease gets into your blood system, we say that's an infection.
Yeah.
So sometimes we find when you do a blood test, nebakugamba nti oyina infection mu musaayi. Okay, that is usually what we are able to see. But now for the reproductive system, There are two kinds of system that we deal with. Waliwo urinary system and reproductive system.
Oh.
The urinary system is made up of structures, nga the urethra, where the urine passes, waliwo kawago, the bladder. Then there are the ureters that connect the bladder to the kidneys. So that entire system from the kidneys, the ureters, the bladder, and the urethra forms what we call the urinary tract system.
Okay.
Reproductive system is made up of the genitals. So in women, it could compose of the vagina, then the uterus, then the fallopian tubes, and then the ovary. So that's the reproductive system
For the woman.
for the woman. In men, it's composed of the shaft of the penis, then it connects to the bladder, then the shaft of the penis, then it connects to what we call the tubes, the epididymis, then the scrotum. That's the reproductive system in men. So when you have an infection and we say this is a urinary tract infection, it means that infection is from all the symptoms are affecting the urinary system. It means that
For the men.
even women,
As you break it down, for the men, it begins from
the urinary system in men is made up of the shaft of the penis, the bladder, the ureters that connect to the kidneys. Okay, I'm sure the producer will be able to show some of those images so that people can see. So in women, it's still made up of the urethra where the urine passes. Okay, the bladder, the ureters, and the kidneys. So they're almost similar organs if it's urinary system.
Yeah.
So if the only difference is that the urinary system in men, the urethra is very long because the penile structure is long. That's why the urine passes to come out. It's called the urethra.
So that's why they say sometimes the infection, such an infection in men could be hard to detect.
It takes longer.
Takes longer. So by the time it has been seen,
it has been there for
or
some
one
time.
day.
Which take it. It means that you've had it for some time. Because when these bacteria begin to climb through the urethra, the women have a very short urethra. It's about 3 centimeters. Men have a long urethra. It's about 15 centimeters. So if you're in contact with the bacteria and you're a woman, it takes a very short distance for that bacteria to enter the bladder, and then it causes symptoms. Now,
so you said women
3 centimeters, very short.
Men 15.
Men over 15.
So even men with small, they are still 15 centimeters.
Small is relative. Yes.
Okay.
It may be less than, maybe 13, depending on how small is small, but average is about 15 centimeters. Now, the symptoms of the urinary tract infection are things like burning when you're passing urine.
Those people who shout.
Those ones who feel pain when they're.
But that's okay. But tugamba nti banziku.
And not necessarily.
People who make the noise.
So the nziku is if there is blockage of the urethra, especially in men. So for example, if you get gonorrhea, where the urine passes becomes very small, so you strain to pass urine.
Gonorrhea is nziku.
I would think so. Because there is a syphilis and gonorrhea. Which one is?
Nziku is what, Mutiaba?
Which one is kabotongo?
Kabotongo must be syphilis.
Then nziku
is gonorrhea. Yes. Nziku eruma. Mu bintu ebyandikutte mu bulamu teyandibaddemu mbonkambwe. And only heroes get it.
What do you mean by heroes?
That's what they say. I don't know why they say it, but
okay, we are not going to divert that. So let's finish the symptoms.
Okay, for urinary
tract
infections. Yes.
Because the nziku is usually on the reproductive system.
Yes.
So one is frequent urination. Someone is urinating all the time. At night they wake up 3-4 times to go and urinate.
That's an infection.
So there could be an infection. All right. Number 2, when you urinate, but you feel like urine has not completely emptied.
All of it. You feel like there are dots still held somewhere.
And you feel that sort of discomfort. Burning when you're passing urine. Burning sensation in Ofuka. And then there are those who get a discharge in the urethra.
Pass.
Yes.
Like pass.
Like sort of a pass like discharge. Then if the infection has gone to the bladder, you feel pain on the stomach. If it has gone to the kidneys, you'll feel pain on the sides or even on the back. Those can constitute. Then if that infection has gone beyond the kidneys and it has entered the blood system, or you start getting fevers, body weakness, generalized body pains, and all. It means if the infection has been there for some time, it has gone into the kidneys, it has entered the blood.
It's now
it's a generalized body infection from the urinary system. It has gone into the blood. Okay.
Yeah.
So those are urinary
Tract
tract infections, and that's how they present.
But treating them is how?
So for those, first we must confirm how we must check the urine. So UTIs, the test for UTIs is a urine test, a urinalysis. Okay, both in men and women.
But is it standard, like even in the European countries?
Yes.
They ask for urine.
It's a urinalysis.
And like stool and urine. Because there's a time they ask you for stool and
Stool is if you have diarrhea and all that.
And you go like, ew.
We ask for those tests.
So even outside the country, people
Even
ask
outside.
for
Where do you think we got the medicine? From them, from outside.
Oh.
The books we read, and they are doing these things there. Okay?
Yeah.
So for urinary tract infections, to call a urinalysis. Now, if you have a recurrent infection, so what is a recurrent infection? This is an infection that has taken, or that has, you've got that infection more than 2 times in 3 months. We have treated you of your infection, UTI, we have treated you. Within 3 months, you've got another infection. Then there's a problem.
Yeah.
Then we think that's a recurring infection. So for that, there are 2 possibilities. Either you have not completed your treatment, because there are people, they take 1-2 tablets.
The moment they are fine,
they stop the treatment.
if the issue was pain when peeing,
if the pain
the
has
moment
gone,
it stops,
they don't complete the dose.
they are like, we are good to go.
Or the infection that you got is a resistant infection. It means that the treatment you're getting does not work on that infection. So for such people, we do another test called a urine culture and sensitivity. Culture means that we get that urine, then we subject it to the right conditions to see which exact bacteria and which exact treatment can clear that infection once and for all. So those are the 2 tests we do. Urinalysis, urine culture, and sensitivity. Okay?
That is treatment.
That is for
Then
checking.
then you
after
get
we
to
give
advise
treatment,
the
then
treatment.
we advise you on treatment.
But now, what I did ask you earlier was, what causes?
Very good. So one is that urinary tract infections can either be caused through poor hygiene. Okay? The places of convenience, all right? The people who sit in the toilets and all that, the people who pee on top of the surfaces, and all that. And someone sits there, if it's a lady, and you get in contact with that area. Remember, the bacteria can easily get into the bladder quickly because you have a short urethra. Then you get that.
So that is why women these days, they be like dog, like they just lift the leg. They don't want to actually sit on the toilet. You've noticed?
A squatting toilet, I have not noticed. Squatting toilets may be better. But the point is hygiene. If you are someone who works in downtown, you get it. Some of those public facilities may not be very clean.
They may not be as good.
So you may, if you can hold your urine, you may have to hold it.
There are people who say the whole day they didn't pee because the toilets were not good.
Yeah, there are people.
But someone can hold urine for a whole day.
Yeah, there are those. Whether you can train your bladder for a whole day. But also, it depends on how much you're drinking. If you're someone who is drinking so much, your bladder is going to get full and you're going to be prompted to actually urinate. So now the treatment will depend. So initially, there is what we call general treatment or broad antibiotics. That when you have an infection, we give you antibiotics that have worked for many people. So that's usually the first line. If you have a UTI, I will give you an antibiotic and say this UTI is, I can see there is a bacteria in this urine or there is a fungal infection in this sample. Then I give you either antibiotics or I give you antifungal treatment. Okay? Then I will ask you to come back after 1 week to repeat this urine test to be sure the infection has cleared. Now that's where other people go wrong.
They never come back.
Someone feels well, they've taken the treatment for 2-3 days. The infection has just reduced and not cleared. Now the person is off. Then they come back after 2 weeks. The infection has come back. No, you never completed the treatment.
Musajja wange Bajjo, he's always having cannulas. Buli kiseera ayogera infection. Eddagala tolimalayo. What facilities are you using?
Yes. Now, the other thing is that they can be caused by sexual intercourse. Although it's not the first, because I know many people tend to assume that every UTI you have, you've got it through sex. Not necessarily. Okay, it can, but not necessarily. That people get UTIs without even being sexually active. So the advice is, if someone is going through treatment for UTIs, maybe that is the time you first withhold having intercourse. Because for you can treat you as a woman. No, the other person has got the infection. When you have sex again, they can actually give it back.
So sometimes you ask them about the partners.
Yeah, we ask, does the partner feel anything?
Did you tell the partner you had an infection when you are treating it?
Or at least abstain for the time that you're undergoing treatment so that you recover from it. And then by the time you resume, you're free from the infection. Okay, so those are the possibilities of where the infection comes from.
Okay.
Now, if the infection is not clearing, again, the culture and sensitivity will tell us which exact treatment can be given so that this person can recover fully.
But
UTIs.
The man has failed to recover from infections.
Either they're treating it wrongly or he's not treating it completely.
I think they're treating, maybe
he's not completing the treatment,
or he's the cause, or he's around the cause.
He's infecting himself.
Because now, like for him, he encourages testing before intercourse. But I think he has not thought about
the UTIs.
So maybe he.
So now the reproductive system, the infections there are not necessarily UTIs, because many people confuse vaginal infections with UTIs. Because vaginal infections could be what we call vaginitis or candidiasis. Okay? And those are not UTIs, because UTIs are only more urinary system. So if you have a vaginal discharge as a woman, there are higher chances in titoina UTI. You have a vaginal infection, you have a vaginitis, you could be having a candidiasis. They test, because if you get that infection, your vaginal infection, first, women are supposed to have a normal discharge. There's a normal discharge a woman is supposed to have. The normal discharge is like mucus, clear mucus-like discharge, okay? That mucus can be thick if you're not near ovulation. If you're near ovulation, it becomes a bit light, watery, okay? So that's a normal discharge. But if you start getting an abnormal discharge, meaning if you get a discharge that is not, has a color, if it's a yellowish discharge, if it is a greenish discharge, if it's a whitish discharge, that is not normal. So you start from there. What is the color of this discharge? Number two, the smell. A normal vaginal infection is not, normal vaginal discharge is not supposed to have a bad smell. But if you start having a bad smell, a fishy smell, a smell that has something that is rotten, okay, that means there's something wrong in either the vaginal system or in the reproductive system. Then you go to symptoms like scratching, itching. You're having itching around the vaginal area.
You want to scratch yourself
all the time. Okay. Now, if that infection is not treated, that infection is going to climb up in women, and it reaches the nirvana, the uterus. In the uterus, that you're going to feel pain on the stomach. You're going to feel pain on the sides. If you don't treat that infection, it will find its way on the tubes and seke, which are usually on the sides of the stomach. Okay? If you don't treat that infection, then that infection can spill into the pelvic area. That is what now we call pelvic inflammatory disease, or PID.
Pelvic inflammatory disease.
You're going to become a musawa.
Soon.
So that is how the vaginal infections evolve. Botanically, abnormal discharge. Then before you know it, you don't treat it, or you're on herbs and all that. Nechiyingira munabana, nechigenda museke, Then before you know it, it has become a pelvic infection. Now, the problem with these infections is that they have long-lasting impacts on fertility. Unlike UTIs, vaginal infections should be treated very, very quickly as soon as you see something abnormal. An abnormal discharge means genda bakebere. The test that we do for abnormal vaginal infections is a high vaginal swab. We need to take off that sample of that discharge. Netukebera.
Omuwa swab.
Aha.
Gwogikubayo yagikubayo. And I'm just asking, like, does she do it herself or you do it?
So it is best the health worker does it.
Oh. But health workers have seen things. So you...
And the reason is because we don't want you to contaminate that sample.
Oh.
If you do it yourself, you'll contaminate it. But if the health worker does it, they will not contaminate because we want to know what exactly is in the discharge.
I see.
So we'll take off that sample, we take it to the lab, netukebera. Which problem is in this discharge? Which bacteria? Then after that, when the results come back, we give you the treatment. If this discharge is coming back all the time, you're getting the problems, discomfort, then we also do culture and sensitivity on the discharge.
To know why is it recurring?
Why is it recurring? Is it that
treatment tajimalayo?
The bacteria is resistant to the treatment? And if the bacteria is not resistant, to which one? Which drug can clear it once and for all? So people should get used to doing cultures and sensitivities because those are the tests that help us to know. But many people come to the clinic and they tell you they have a discharge and you tell them, can we check, can we remove the sample? Never gonna.
But your body is
But we want to help them feel better.
Then we also have the issue of online. ChatGPT. I'm feeling itched down there.
What should I?
And then ChatGPT says, maybe you are horny. You know ChatGPT can give you those options. ChatGPT can say, maybe you are horny. So some of them then just rush to have sex. Instead of they have infection.
Some bad discharges could be cancer.
Hey.
Yes. Especially if you're having a foul discharge. Okay, that is causing you pain during intercourse or bleeding after sex. That's why when we do a high vaginal swab, we are also checking the cervix. We look at it. You may find that by the time you look at the cervix, it is not looking fine. Then you end up doing a cancer cervix screening.
And you give the person their news.
And you tell them what is happening.
That it's cancer.
Or not.
But cancer that comes from down there. This must be a bit painful.
It is.
It must be painful, especially when they were asking for it and you were refusing.
Asking for what?
Yeah, for some. people ask, so throw me some. You say, no, I'm waiting for the right man. Then cancer comes.
But you see, actually, now that you've mentioned cancer, cancer is very high in women who are having multiple sexual partners. Especially cancer of the cervix. Number two, women who start intercourse very early. Because cancer of the cervix takes over 10 to 15 years to form. So number three, if you are having a husband who has multiple sexual partners,
you're prone
to
getting it.
Because these men carry a virus called HPV. That virus is the one that causes cancer of the cervix.
Oh, wow.
So if your man is jumping from one place to another, that man is going to get HPV and deposit in everywhere he goes. So meaning that you're going to be at risk.
10 to 15 years later.
15 years.
Wow.
So it's very important that when you have an abnormal discharge, that you are checked. But also, it's very good for women out there to have a regular cervical cancer screening. Because if something takes 15 years, if you check every 5 years, you can find it before it becomes cancer.
Yeah.
Then you
it
treat
becomes that bad.
And now finally for the men.
UTI. Vaginal infections.
Yes. For the men. For men, they can also have... So actually most of the infections that affect the reproductive system are usually called sexually transmitted infections,
STIs.
STIs. So that's why you have things like herpes, things like gonorrhea, enziku.
Syphilis.
Today I've known the difference between enziku and kabotongo.
Kabotongo is syphilis. Gonorrhea is enziku.
There's what they call chlamydia. Okay. Yes. So there's what they call trichomonas vaginalis.
For men again.
No, for women. There's what they call bacterial vaginosis. Bacterial vaginosis is usually common in women whose pH changes. So the normal pH of the vagina is acidic. The vagina has acids. There are bacteria that produce acids inside the vagina. But that acidity protects the vagina. That's why we tell women they should not be cleaning, they should not be douching and putting
soap,
scents and all those things, steaming and all that. Because you affect the pH of the vagina.
They shouldn't steam.
We don't encourage them.
What about yogurt? They told us, there's someone who told us yogurt.
To put it inside.
Like you pass it there maybe sometimes.
We don't encourage to put anything. The vagina can clean itself.
It has to smell raw.
It has to clean itself. Kasuku, don't change my...
Oh, to clean itself, okay. Sorry.
So don't be cleaning the place. You should allow it to clean.
Allow it to clean itself.
Because when you put these things, you change the pH. When you change the pH, you're more prone to infections.
pH
ojukira musinia tu
njijukira
waliwo acid and alkaline pH.
So you shouldn't wash it.
We don't encourage. Please do not put anything in the vagina. Allow it. It takes care of itself. It has its own ecosystem. Now, for my friends, the men, now, much as we take long to get UTIs, we can get STIs easily. Okay? And STIs, things like gonorrhea, we talked about, syphilis. And usually, of course, the signs are if you start getting a pus-like discharge from your penis, okay? That is something that is abnormal. You could have got an STI, gonorrhea. Gonorrhea is actually one of the fastest, it's one of the diseases that gives you symptoms so quickly. Within 1 to 2 days of having sex with a person who had gonorrhea, you will have symptoms. You will not even take a week, neither. Because for it, once it has entered, it starts off.
It is that active and
very
fast
active
and tough.
Now, of course, you will have burning when you're passing urine. You'll have the pus. You'll have pain around the shaft. You may also have pain around the testes. Okay? Some even get a bit of swelling, okay, around the testicles. So that could point towards a sexually transmitted infection. Now, if it's things like syphilis, we may end up having rashes and wounds around the penis.
Yeah.
Yes. If they are, for men who are not circumcised, if they are having candida infections, they may end up having a whitish discharge around the area of the skin, or they end up having oquetacular itching around the shaft of the penis. So again, when you have a discharge, you come to hospital, we take off a swab of the discharge for the man.
So for the men, should they wash it? For
the what?
The penis.
Wash? I thought they wash. Is that?
And you said the vagina washes itself.
No,
so the men, should they wash?
Yeah, for the men, if they're not circumcised, they should move the skin forward and clean themselves. But also when you're showering, you wash yourself. So for the men, but of course you don't wash inside where the urine is passing.
Yeah. You wash on the surface. So do you also wash with soap? Like
yes,
they wash it with soap.
Yes, keep it clean.
For it doesn't have pH.
No, it doesn't have pH.
Now I'm asking for those people out there so they know. So now, for the women, what just for purposes of clarity, it is supposed to smell how? So that you know this is not infection.
That's why I told you already.
Yes, because abantu bagwa mu mbi eyo ebintu ne bibatabukako.
No, it should not smell bad. And every woman out there knows what something bad smells. It should not smell like fish, a fishy-like smell. It should not smell like something is rotten. Okay?
Can it smell like meat? Raw meat?
I've left you guys.
Because they say it is raw.
So many
Tukome wano. Kale. Mubeere bulungi mwera.
The views expressed on Kasuku Live do not reflect those of the host, producers, or management. They are solely of individuals providing them and do not represent or reflect the official policy or position of this YouTube channel.
abakyala
wereso omuyomba enyembuto katonda yekyembuto genda wegiwaminge
yabaweereza buno bukeeke obutini
singa baaba omutwale bamusonseka mu kamwa bwonna n'abufulumiza mu nnyindo
kibwa alina guno omuggo gwa musa wayitista bibiyamu detergent
waliwo wanagambye ebola y'akasajja kasendi kalimba bannange esendi bannange